This message comes from NPR sponsor HP. Break language barriers by translating languages in real time with the HP AI PC. With the right tools, work doesn't have to feel like work. More at hp.com/AI PC.
Hello, hello. I'm Brittany Luce, and you're listening to It's Been a Minute from NPR, a show about what's going on in culture and why it doesn't happen by accident. For those who've been keeping up with our Your Body, Whose Choice series, we focused a lot on the present and the future of reproductive health in this country. But now I'd like to share a look at the past from our sister show, Embedded. Their new 3-part series, The Network, follows the Brazilian women who discovered a method to have safe abortions regardless of the law. And as abortion restrictions tighten in the United States, American women have taken note. We have the first episode here just for you. And just a warning for listeners, there are some graphic depictions of medical procedures and abuse in this episode.
Hey, I'm Kelly McEvers, and this is Embedded from NPR. We've got a new series. It's about one of the biggest political and social issues in the United States right now, abortion. But this isn't a story about the abortion debate, whether abortion is right or wrong, whether it should be legal or illegal. It's about a set of people on one side of the issue who are operating regardless of what the law says about abortion. These people are part of a global movement that's had a major impact on how women have abortions. And the hosts, Victoria Estrada and Marta Martinez, are going to take us all over the Americas to follow this movement. They're journalists for Latino USA. That's a public radio show produced by Futuro Media. And we partnered with them to make this series. Okay, here's Victoria and Marta.
It was one of those moments when people understand they're witnessing history. They remember where they were.
I was standing at my standing desk in my house, waiting, and
I just started crying at my desk.
It was totally surreal.
They remember where they were when Roe versus Wade fell.
The biggest change to abortion rights in the United States in nearly half a century is here.
The Supreme Court had made its decision.
A ruling that ends the constitutional right to an abortion.
While abortion rights opponents celebrated the news that Roe had been overturned,
we will abolish abortion.
Many abortion rights supporters feared the U.S. was going backwards.
Back to the 1900s? What are they going to take from us next?
Back to a more dangerous time.
This is an emergency. This is an extreme crisis. People will die across the country.
Protesters gathered on the steps of the Supreme Court in Washington, D.C.
Abortion saves lives!
Holding images of coat hangers over their heads.
My choice! My body! My choice!
The day after the fall of Roe, 13 states immediately banned or severely limited abortion. Eventually, nearly half of all states did. And within a month of the ruling, dozens of clinics stopped performing abortions, forcing many Americans to travel hundreds of miles to get one. Other laws targeted abortion providers.
Are you scared?
I am scared, and I think a lot of us are, because there's nowhere else in medicine that is policed and regulated and now criminalized to such a degree.
You don't care if people die! Pro-life is a lie! You don't care if people die!
But not all abortion rights supporters felt this way.
Everybody was so calm in the network.
The Network. It's what we're calling the diffuse set of people who are expanding abortion access in an unconventional way. They were not panicking.
Everybody was like, we've been doing this work. We're going to continue doing this work. Nothing is changing. Who cares?
I'm actually energized.
This network, it's hard to even describe because it's not formal or centralized. There's no CEO, no headquarters.
Some people work together, but plenty don't know each other. They're midwives and nurses, grandmothers and friends.
This network crosses borders and reaches people throughout the world, from South Africa to Myanmar to Mexico, and all over the United States. What unites the network is how they are expanding abortion access, by helping women have safe abortions on their own, without a doctor involved.
Their method grew out of a very small thing. It actually fits in the palm of your hand.
But despite being physically tiny, when it comes to reproductive health, doctors, researchers, and people working in this field say it's been
monumental,
extraordinarily important,
fundamental.
It's a lifesaver in so many ways.
It's the equivalent to the discovery of penicillin because it's a before and after.
But unlike penicillin, this discovery has not been universally embraced. Instead, it's the latest target of abortion restrictions that continue to make the news.
The future of abortion access could be impacted by a new lawsuit just filed by the Attorney General of Texas.
A long-dormant federal law prohibits the mailing of any supplies used for abortions.
Possession could be punishable by up to 5 years in prison.
From NPR's Embedded and Futuro Media's Latino USA, this is The Network.
A series about the DIY method that took safe abortions out of the clinic, and the women who made it happen.
Episode 1, Saintotech. We'll be right back.
Support for NPR and the following message come from Betterment, the automated investing and savings app. CEO Sarah Levy shares why they provide tools and technology for retail investors, small businesses, and independent investment advisors.
At Betterment, there is one unifying idea, which is the idea of expanding access. Historically, great financial advice was reserved for the wealthy, and what technology has done is basically lowered the barrier to entry and created an on-ramp for people earlier in their financial journey to get access to great advice. The same is true for small businesses, where mid and small-sized businesses have not historically been able to afford a retirement solution for their employees. So again, Betterment's technology allows smaller and smaller companies to attract the best employees. And then lastly, for financial advisors, what we've done again is expanded access by automating and using the scale that technology can provide.
Learn more at Betterment.com. Investing involves risk. Performance not guaranteed.
This message comes from NPR sponsor Rocket Money. Rocket Money is a personal finance app that helps find and cancel your unwanted subscriptions, monitors your spending, and helps lower your bills so you can grow your savings. With over 5 million users, Rocket Money has saved a total of $500 million in canceled subscriptions, saving members up to $740 a year when they use all of the app's premium features. Reach your financial goals faster with Rocket Money. Go to rocketmoney.com/minute today.
This message comes from DSW. Where'd you get those shoes? Easy, they're from DSW. Because DSW has the exact right shoes for whatever you're into right now. You know, like the sneakers that make office hours feel like happy hour, the boots that turn grocery aisles into runways, and all the styles that show off the many sides of you. From daydreamer to multitasker and everything in between, because you do it all in really great shoes. Find a shoe for every you at your DSW store or dsw.com.
I'm Victoria Estrada.
And I'm Marta Martinez. We're both producers at the public radio show Latino USA. We've been covering reproductive rights in the Americas for years now.
And when we started to see more and more challenges to abortion access in the US, we immediately thought about Latin America, because historically, Latin America has had strict abortion bans, not so different from what we're seeing now in parts of the US.
But as research from around the world shows, bans don't stop people from getting abortions. They just lead them to take more risks to end their pregnancies. That's where the phrase back alley abortion comes from, and where we get the image of a woman using a coat hanger, self-managing her abortion.
But nearly 40 years ago in Latin America, women developed an abortion method that was medically safe and effective, no doctor needed. And this new type of self-managed abortion transformed how abortions happen across the world today.
It all started in Brazil, where this method was born in the late 1980s. Victoria and I took a trip there last year, in 2024. And one of the people we interviewed was Jacqueline Pitangui.
Hi, Jacqueline.
Jacqueline is a longtime feminist advocate.
How was your day?
And she lived through Brazil's military dictatorship, which lasted for more than 2 decades. When the dictatorship fell in 1985, she fought to get women's rights into Brazil's new constitution, because women at the time had so little say in their workplaces, marriages, or over their bodies.
So here in front, you have the Christ.
Oh, it's right here.
Right here. But
from Jacqueline's balcony in Rio de Janeiro, we could see what's probably the most iconic image of Brazil, the statue of Christ the Redeemer.
So you see it every day in the morning when you wake up?
I see it right every day when I wake up.
Say hello.
Yeah, I say hello, Christ. How are you? Be good, Jesus Christ.
Maybe you've seen it in a movie or photos. It's this huge sculpture overlooking the whole city of Rio de Janeiro on top of this spectacular cliff.
It's interesting because I was actually talking about this with Victoria this morning, that religion is very present in this city in a very visual way, because you have the Christ up there in the mountain looking at you
all the
from
time.
Everywhere.
Yeah, everywhere. Yeah.
It's this constant reminder of the influence Catholicism has had on Brazil for much of its history.
For the Catholic Church, contraception has always been a key issue.
Until the 80s, many Brazilian women didn't have great access to birth control. Before then, in the poorest region of the country, women had on average almost 6 children.
We heard that some women just didn't know much about their own bodies. For example, some women were afraid of using tampons because they thought they might get lost inside of their vaginas. We also heard that some women thought that their vagina was connected to their mouth.
This lack of knowledge had serious consequences.
The significant, let's call punishment, it was on women's bodies. Death or morbidity.
Okay.
Could you just count to 10?
1, 2, 3.
In the 1980s, Brazil's maternal mortality rate was higher than most of the rest of the world.
Eu vivi uma época que as mulheres adoeciam e morriam.
I lived through a time when women got sick and died of infection, died of bleeding, young women, extremely young women.
This is Dr. Rivaldo Albuquerque.
Sou médico gineco-obstetra.
I am a gynecologist. I am a practicing Catholic, and I have been working with women's health since I was a medical student.
We visited Rivaldo in the coastal city of Recife in northeast Brazil. It's the poorest region in the country. When he started working in a public hospital in 1985, the state that Recife is in had the highest maternal mortality rate in all of Brazil. Rivaldo saw it every day in the emergency room. A lot of pregnant women coming into his ER with complications from a lack of prenatal care, like chronically high blood pressure, and also complications from abortion.
Abortion was, and still is, illegal in most cases in Brazil, and it was often seen as a sin. But that doesn't mean women were not getting abortions. Research from that time estimated there were between 1 and 4 million abortions happening in the country every year.
People who had the money could look for doctors who did abortions in clinics, in hospitals, with every safety precaution, using sterilized material.
In other words, people who had the money could go see a doctor who was willing to break the law for the right price. Those were not the women who ended up in the emergency room where Rivaldo worked. His patients had often gone to places that were less reputable and unsafe.
Others just tried to self-manage their abortion. We heard about lots of ways. Herbs, teas or drinks,
chás, bebidas,
insertion of foreign objects,
hastes de guarda-chuva,
the rods of an umbrella,
agulha de crochê,
needles,
and whatever medicines they could buy at the pharmacy.
You know, all the horror stories that you read about.
By the time women got to Rivaldo, they often had perforations in their uterus, hemorrhages, and serious infections.
Rivaldo told us about a specific case that has stayed with him. It was a patient who was only a few years younger than he was at the time.
Era uma mulher de 19 anos que já tinha 2 filhos.
She was a 19-year-old woman who had already had 2 children. She came in with a generalized infection. It was a desperate condition, and we didn't have any background information about this woman. She wouldn't speak. She was in no position to explain what had happened to her, and the person who brought her in didn't want to talk either.
Rivaldo and the other doctors suspected she'd had an unsafe abortion, and so they decided to do an exploratory operation.
So that we could evaluate the abdomen, what was happening with this infection. And when we opened the abdominal cavity, we found a uterus that smelled, pardon the word, rotten.
Rivaldo still remembers it.
A terrible smell with several perforations. It was a classic picture of an unsafe abortion. Since it's an illegal procedure, this woman must have stayed home for a few days or didn't receive proper medication.
Who knows how long she waited to go to the hospital after signs that something was wrong. And now, there was nothing the doctors could do.
Why did this woman die? I can tell you without hesitation. Because she was black and because she was poor.
Porque era negra e porque era pobre.
Rivaldo told us he really felt for these women.
They are in a situation of suffering, of vulnerability. Their health and their life are at risk. I know these women. Many are Christians, evangelical, Catholic, but they are going through a specific moment in their life. They are in need.
But Rivaldo was an exception. Many doctors did not treat these patients well.
Women who had tried to have an abortion were the last ones to be treated during our shift.
So these women, they would be in the emergency room all day long, without food or anything to drink.
They spent the whole day fasting, waiting for their procedure on an empty stomach, and they were being punished because they were the last ones to be taken care of.
He remembers that some doctors wouldn't give the women enough anesthesia before their dilation and curettage, or DNC. So the women would feel the pain of their cervix being dilated and the walls of their uterus being scraped.
And the women cried out because of the pain, of their suffering. Unfortunately, I heard medical staff say, when you did it, it was a lot of joy, a lot of pleasure. And now you're crying. You don't know what you did. You killed the baby.
One doctor told researchers at the time that his hospital was doing 2 hysterectomies a week because of so many botched abortions. Another doctor called working with these patients a, quote, revolting process because she was presenting us with a disgusting mess, unquote.
Some doctors went even further than insulting the women. In some cases, they called the police.
And the police would come all the way to the hospital and handcuff the women. They would chain them to the bed. Women were arrested.
Rivaldo says his hospital never let this happen, but he knew it happened elsewhere.
That was the standard for these women. So these are things that I will never forget.
São coisas que eu nunca vou esquecer.
At the end of his shift, Rivaldo would make notes about his patients, who lived, who died.
How many births, how many C-sections, how many surgeries, how many abortions, how many infected abortions.
And around the year 1987, he noticed a change.
A big change.
Severe cases of infection, severe cases of hemorrhage, they disappeared.
Women were still coming into the ER, but they were showing up with new symptoms, much less serious ones.
like an increase in body temperature, hyperthermia, and it didn't make sense because you couldn't find an infectious condition. Some women also had gastrointestinal symptoms. We realized that there was something different, and this made us a little confused.
Isso deixou a gente pouquinho confuso.
Around the same time, a researcher named Sara Costa was working for Brazil's School of Public Health in Rio de Janeiro, more than 1,000 miles south from Recife. And she noticed another big change.
We were seeing this incredible decline in fertility.
Suddenly, women were having fewer children. But why?
It was strange, because there were no big policy changes to account for it.
The government wasn't providing much information about how to control fertility.
And abortion was still illegal, so something just wasn't adding up.
Was it spontaneous use of oral contraception? How were they getting it?
So in the early 90s, Sara began talking directly to the women.
And we conducted those interviews over a period of several months and analyzed the results.
She and her team interviewed more than 800 pregnant women in 7 hospitals in Rio de Janeiro. Many of those women had come into the hospital bleeding. Hospitals in Rio and in other parts of the country had been seeing more cases like this in the past few years, of women who seemed like they had attempted an abortion.
We thought we would actually discover a lot more complications, serious complications. But most of the women went into hospital with bleeding, had a curettage, and left.
Left? They didn't get stuck in the hospital with infections or other complications.
It was a bit of a surprise.
In Recife, Rivaldo had noticed a similar pattern.
We had a downward curve in mortality, a downward curve in abortion complications. And then there was a moment when you almost didn't see any complications of abortion at all.
Praticamente não via complicações de abortamento.
Fewer complications from abortion meant one thing.
Deixou de morrer mulheres.
Women stopped dying.
Or at least far fewer were dying. From 1986 to 1991, the time Sara and Rivaldo were observing, the World Health Organization recorded a 21% drop in Brazil's maternal mortality rate.
It seemed like magic, or a better word,
milagre.
A miracle.
To hear the cause of what Rivaldo calls a miracle and the rest of Embedded's 3-part series, The Network, search Embedded wherever you get your podcasts.
The Network from Embedded is a collaboration with Latino USA, a production of Futuro Media. This episode was produced by Mónica Morales Garcia and Abby Wendell. Raina Cohen edited the series. Additional reporting by Abby Wendell. Fact-checking by Cecile Davis-Vasquez, Nicolette Kahn, and Giovanna Romano Sanchez. Robert Rodriguez mastered the episode.
Voiceovers by Mariana de la Barba, Julia Carneiro, Marcelo Starobinas, and Susi Valerio. Liana Simstrom is our supervising senior producer. Katie Simon is our supervising senior editor. Irene Noguchi is our executive producer. And Colin Campbell is the Senior Vice President for Podcasting at NPR. The Embedded team also includes Luis Treyes, Dan Girma, Adelina Lancianis, and Ariana Garib-Lee. From Latino USA, our executive producers are Marlon Bishop and Benilei Ramirez. And our production managers are Jessica Ellis and Nancy Trujillo.
Thanks to our managing editor of Standards and Practices, Tony Kevin, and to Johannes Dergi and Micah Ratner for legal support, and Tommy Evans, NPR's managing editor, editorial review. Our visuals editor is Emily Bogle. Original tile art by Luke Medina.
Special thanks to Alyssa Natwarney, Selena Simmons-Duffin, Mariana de la Barba, Maria Marta Bruno, Julia Carneiro, Roberta Fortuna, Dina Ortega, Kelly Blanchard, Maureen Paul, Lourdes Rivera, Abigail Aiken, Giselle Carino, Dee Redwine and Jefferson Drezet. And a big thanks to our Embedded Plus supporters.
Funding for this series provided in part by the Levi Strauss Foundation, outfitting movements and leaders fighting for a more just and abundant world, and the International Women's Media Foundation as part of its Reproductive Health, Rights, and Justice in the Americas initiative. I'm Marta Martinez.
I'm Victoria Estrada.
This is Embedded from NPR.
Thanks for listening.
Muchas gracias por escuchar.
Support for NPR and the following message come from IXL Online. Is your child asking questions on their homework you don't feel equipped to answer? IXL Learning uses advanced algorithms to give the right help to each kid, no matter the age or personality. One subscription gets you everything. One site for all the kids in your home, pre-K to 12th grade. Make an impact on your child's learning. Get IXL now. And NPR listeners can get an exclusive 20% off IXL membership when they sign up today at IXL.com/NPR. Support for NPR and the following message come from Rosetta Stone, the perfect app to achieve your language learning goals no matter how busy your schedule gets. It's designed to maximize study time with immersive 10-minute lessons and audio practice for your commute. Plus, tailor your learning plan for specific objectives like travel. Get Rosetta Stone's lifetime membership for 50% off and unlimited access to 25 language courses. Learn more at rosettastone.com/NPR.